Hey guys, this is Michelle from Virtual Hand Care, and in this video, I'm gonna show you 2 splints to stop trigger finger. So the 2 splints that I have with me today are an MP block, and I also have an oval 8 splint. And the oval 8 splint can be used to block both the PIP or the DIP joint. Either of these splints can help you. There's actually research that shows simply blocking either your MP joint, your PIP joint, or your DIP joint can be enough to help stop the triggering of your finger. The reason for that is it does not allow your finger to go into full flexion. That's when the trigger happens, is when your finger goes down into full flexion. So by applying a splint, either a ring or a MP block like this one, you're still able to use your hand without worry of triggering or locking or catching of your finger. Now, one thing I want you to notice about these splints is that they don't immobilize your whole entire finger, right? You have some flexibility and use of your fingers. At least 2 joints are free to move at all times. There are a lot of splints out there and a lot of prefabricated ones that you can find online that immobilize the whole entire finger. And really that's unnecessary, and it really can lead to a very stiff finger. So do keep that in mind when you are doing your research for trigger finger splints. So first, let's look at the MP block. There are a lot of different types of MP blocks out there. You could get a custom fabricated MP block made for you, like this one here. However, you do have to have a certified hand therapist make one of those for you. That can be very helpful, especially if you have a larger joint to where maybe a ring or something can't quite fit over your finger. There's also a lot of very comfortable prefabricated ones like this one here. It depends on your comfort level and what is right for you and what you really use your hand for. Now, one of the benefits of having an MP block is that some people feel like they get a little more flexibility, a little more mobility in the fingers because you have your DIP and your PIP joint free. So they can be very helpful for certain activities. Now, one of the reasons why some people don't care for this type of splint is because it blocks your palm, right? You have kind of this larger piece of plastic that is kind of digging into the palm. It can be a little bit tender, especially if you already have a little bit of tenderness over that pulley in the palm. And depending on the activities you're doing, it can kind of get in the way. Now let's look at the oval 8 splint. So the oval 8 can actually be used to block either the PIP joint, or it can be used to block the DIP joint. So let's look at placing the oval 8 at the PIP joint. When you block the PIP joint from flexing all the way down, it still allows you to get some mobility in the tip of the finger, and you also get quite a bit of mobility in the knuckle here. However, what you don't get is a lot of that mobility in the middle joint, which for some people, and depending on the activities you're doing, they don't really like that because that really seems to get in the way of them grasping items. They might drop items. Now that's where perhaps using the oval 8 to block the DIP joint can be a little bit more helpful for, most daily activities that you do. Now, as you can see with putting the oval 8 at the DIP joint, it won't let you bend the DIP. However, you can bend at the PIP and at the MP joint. That can be a lot more functional to have an oval 8 at your DIP joint. However, for some people, they do need a little bit more of a block. Having a ring on more of the tip of the finger, then you might be more likely for that to slip off. And also keep in mind, whenever you have rings on your finger, they fit over your joints, right? So you want to make sure that you get the right fit, because if your joints are very large, then you're going to want to size up with the oval 8 ring. However, when you size up, keep in mind that might allow you to bend a little bit more and could potentially make you bend and possibly lock that finger. Now with the MP block, there really is no question as far as how to put this on. However, I have found with the Oval 8 that some people are not quite sure how to wear this, and they put the Oval 8 on and they say that they're still able to bend and that it doesn't work. Well, it's because they had the splint on backwards. If you decide on the Oval 8, you want to make sure that the opening here is on the palmar side of your fingers so that it can truly block your fingers from flexing. And all of these splints can be fitted on any one of your fingers. So I do encourage you to really look at these three options, either blocking the MP joint, blocking your PIP joint, or blocking the DIP joint. It really is an individual preference. It really depends on the work you do, how you use your hand throughout the day, overall swelling in the hand, tenderness and pain and functionality. Do keep in mind, you do have the option of having multiple different splints depending on the activity. So if for some activities it's better to have your DIP and PIP free, then put the MP block on. However, if you don't like the bulkiness of this when you're perhaps doing the dishes, then put one of the Oval 8s on your finger. That is the wonderful thing about these types of splints, is that you're not triggering with your activities so that you continue to cause that inflammation in the hand. So you want to make sure that whichever splints that you do pick and choose, that there's something that you can wear for several weeks. Sometimes it's 6 to 8 weeks to stop your finger from triggering. Now, I do have several other videos on trigger finger and trigger thumb that I will link here. So you definitely want to make sure that you check those out, because really just finding splints that work for your hand is just a small piece of the puzzle. You definitely want to work on stretches and exercises too, so that your finger does not get stiff. If you did find this video helpful, do please give it a like and let me know in the comments below what you thought of this video. Let me know if you've tried any of these splints and how they worked for you. Don't forget to hit that subscribe button below and check out these videos here that YouTube is suggesting for you. Thanks for watching.